Hooked intro. Ever wondered how we fight off the invisible enemies lurking all around us? From a simple cut to a life-threatening infection, tiny organisms can cause big problems. But we have a powerful arsenal to combat them: antimicrobial agents. In this video, we're diving deep into the world of antibiotics and other microbe-killing drugs. We'll explore what they are, how they work, and how we use them to save lives. Whether you're a student preparing for an exam or just curious about the science of medicine, this comprehensive guide will break down everything you need to know about antimicrobial agents. Main content. First, let's define our terms. A chemotherapeutic agent is any agent used to treat conditions caused by microorganisms, and it's also used in cancer management. More specifically, an antimicrobial agent is a drug used to treat infectious diseases by either inhibiting or killing pathogens like bacteria, fungi, and viruses. The term antibiotic is often used synonymously for drugs that manage bacterial infections. These can be bactericidal, meaning they kill bacteria directly, or bacteriostatic, which means they inhibit bacterial growth, relying on our immune system to clear the infection. Antibiotics are also categorized by their spectrum. Broad-spectrum antibiotics are effective against a wide range of bacteria, while narrow-spectrum antibiotics target either gram-positive or gram-negative bacteria specifically. Limited-spectrum antibiotics are even more targeted, effective against a single microorganism. Examples of antimicrobial agents include antibacterials, antifungals, antivirals, and antiparasitic agents. The goals of antimicrobial therapy vary. Prophylactic therapy is preventative, given to individuals at high risk of infection. Preemptive therapy targets high-risk patients who have a positive lab test but no symptoms. Empiric therapy involves treating a suspected infection before culture results are available, while definitive therapy is treatment based on specific culture information. An ideal antimicrobial agent has selective toxicity, meaning it harms the pathogen with little to no effect on the host. It should also be non-allergenic, stable in the body, have few side effects, and be inexpensive. When selecting an antibiotic, clinicians consider its spectrum of activity: the patient's age, allergies, kidney and liver function, and pregnancy status. While the desired effect is curing the infection, antibiotic therapy can have undesirable effects like allergic reactions, side effects from overuse, and superinfections, which occur when the normal body flora is destroyed, allowing other organisms to overgrow. Bacteria are broadly classified into gram-negative, like E. coli and Salmonella, and gram-positive, like Staphylococcus and Streptococcus. Antibacterial agents are classified by their mechanism of action. Some, like penicillins, inhibit cell wall synthesis. Others inhibit protein synthesis at different ribosomal subunits. Some inhibit folic acid or nucleic acid synthesis. Now let's focus on penicillins. All penicillins share a basic chemical structure featuring a beta-lactam ring, which is essential for their antibacterial activity. They are classified as beta-lactam compounds. Natural penicillins, like penicillin G, are produced by the fungus Penicillium chrysogenum and are effective against many gram-positive and some gram-negative bacteria. Semi-synthetic penicillins are chemically modified derivatives that may have a broader spectrum of activity or be effective against resistant bacteria. These include penicillinase-resistant penicillins, which are not inactivated by the bacterial enzyme penicillinase, and extended-spectrum penicillins like ampicillin and amoxicillin, which are more effective against gram-negative bacilli. To combat resistance, some penicillins are combined with beta-lactamase inhibitors like clavulanic acid, which block the enzymes that degrade the antibiotic. The general mechanism of action for beta-lactam antibiotics is the inhibition of bacterial cell wall synthesis. They bind to specific proteins called penicillin-binding proteins, PBPs, in the bacterial membrane, inhibiting the transpeptidase enzyme that cross-links the peptidoglycan chains of the cell wall. This weakens the cell wall, leading to cell lysis and death. In terms of safety, penicillins are generally considered safe during pregnancy, falling into Category B. They are used to treat a wide range of infections, from throat infections and meningitis to bone and joint infections and UTIs. Specific penicillins are chosen based on the suspected or confirmed pathogen. For example, flucloxacillin is used for S. aureus infections, while amoxicillin is common for respiratory infections. However, penicillins are not without side effects. The most significant is hypersensitivity or allergic reactions. Other side effects can include diarrhea, nephritis, kidney inflammation, neurotoxicity at high doses, and hematologic toxicities. They can also interact with other drugs. For instance, probenecid can prolong their action, while some other antibiotics can work antagonistically. They may also reduce the effectiveness of oral contraceptives. Take home. Keynotes. Sim. Antimicrobial agents are drugs that kill or inhibit pathogens. Antibiotics specifically target bacteria. 2. They can be bactericidal, kill, or bacteriostatic, inhibit growth, and broad or narrow spectrum. 3. Therapy goals include prophylaxis, prevention, empiric, presumptive treatment, and definitive, targeted treatment. 4. Selective toxicity is the most desirable property, meaning the drug harms the pathogen, but not the host. 5. Penicillins are beta-lactam antibiotics that work by inhibiting bacterial cell wall synthesis, leading to cell death. 6. Bacterial resistance occurs through mechanisms like producing beta-lactamase enzymes, which destroy the antibiotic. This can be countered by using penicillinase-resistant penicillins or adding beta-lactamase inhibitors. 7. The most critical side effect of penicillins is hypersensitivity, allergic reaction. They can also cause diarrhea and interact with other medications. Summary for exam preparation. Antimicrobial agents are a cornerstone of modern medicine, used to treat infectious diseases. Key concepts include the difference between bactericidal and bacteriostatic action, and broad versus narrow spectrum activity. The primary goal of therapy is to eliminate pathogens with minimal harm to the host, a principle known as selective toxicity. Selection of an agent depends on the pathogen, host factors, like age and organ function, and drug properties. Penicillins are a major class of antibiotics that disrupt cell wall synthesis by binding to penicillin-binding proteins and inhibiting transpeptidase, thus preventing the cross-linking of the peptidoglycan wall. They are classified into natural, penicillinase-resistant, extended-spectrum, and anti-pseudomonal types. Resistance is a major challenge, often mediated by beta-lactamase enzymes. This is addressed by co-administering beta-lactamase inhibitors, e.g., clavulanic acid with amoxicillin. While generally safe, penicillins can cause significant hypersensitivity reactions and other side effects. Understanding these classifications, mechanisms, and clinical considerations is crucial for their effective and safe use.